Ay, salamat po. Maraming salamat po.
Good morning, everyone, and thank you for joining us in this Webicon brought to you by Cardinal Santos Medical Center. I am Dr. Ronald Christopher Kua, your friendly rehabilitation medicine doctor. We experience pain in all forms, may it be through heartaches, death of a loved one, or even being stricken by COVID-19. Another form of pain that everyone can relate to is actual physical pain. With the social restrictions imposed due to COVID-19, Most of us are stuck in the confines of our homes 24/7. Work, lectures, and meetings for some of us are mostly done within the walls of our houses and offices. Without much movement or because of bad habits, many of us would experience body pain and aches that became more frequent now during this pandemic. In an effort to raise awareness about the importance of physical medicine and various rehabilitation treatments, Cardinal Santos Medical Center is holding a Webicon entitled Pain, Pain, Go Away, a Webicon on different methods to alleviate common movement-related pain. Part of our advocacy at Cardinal Santos Medical Center is to make quality and innovative healthcare accessible to everyone by first educating them about the life-saving services that are available to them. For today's session, we will hear from our 4 excellent speakers. Apart from our experts, we will also hear about the experience of one of our patients who have experienced the services and procedures we will be discussing today. Hopefully, from his perspective, we can all learn about what truly matters when it comes to caring for one's health and well-being. After that, we will open the floor for questions. We would like to ask everyone to please stay on after the open forum for our group photo op to commemorate this momentous occasion. Just a few reminders for this Webicon. First, may I remind all panelists to mute their microphones during the session to avoid distracting our speakers. For the open forum, please type your questions using the Q&A function of Zoom. And finally, after the session, please take time to give us your feedback about this Webicon by logging on to www.menti.com using the code 64241900. You may also access the evaluation form, which will be sent to you after the session. To officially start this session, allow me to introduce to you our first speaker. She's a graduate of BS Physical Therapy from University of Santo Tomas, completed her medical degree at St. Luke's College of Medicine and residency in physical medicine and rehabilitation at the University of Santo Tomas Hospital. She's affiliated with the following medical organizations: Philippine Medical Association, Quezon City Medical Society, Philippine Academy of Rehabilitation Medicine, American Academy of Rehabilitation Medicine, International Society for Clinical Densitometry, International Osteoporosis Foundation. She is particularly interested in musculoskeletal and neuromuscular rehabilitation. To talk about back pain, the most common of all pain that we can all relate to, and other important things we need to know about it, ladies and gentlemen, may I call on Dr. Joanna Macrojo.
Good morning, everyone. I hope everybody is doing well today. As most of us have been working from home for the past year and are constantly immersed with numerous web meetings, we're getting more prone to sustaining back pains. So in the next few minutes, let me share with you basic things that you need to know about this condition. In the local statistics, 1 out of every 3 occupational diseases reported is back pain. And this more or less equates to about 11 working days lost in a period of 6 months. Globally, low back pain is the leading cause of disability among musculoskeletal conditions. Back pain can occur across lifespan, meaning both the young and the old can have it. So having back pain does not necessarily mean that you are old. Bata pa po tayo, masakit lang po likod natin. Back pain has many repercussions. It can limit mobility, resulting in decreased productivity and loss of income. This in turn leads to early retirement and reduced accumulated wealth. It can also reduce our participation in society. Sometimes may namimiss po tayong mga events dahil masakit po yung likod natin. So as you can see, back pain can affect practically all aspects of our lives. So it is best not to ignore it. Back pain can range from muscle aches to shooting, burning, or stabbing sensation. And it may be localized or deep down the arms or the legs. Bending, twisting, lifting heavy loads, or prolonged sitting, prolonged standing, prolonged walking may further provoke the pain. Commonly, it usually affects our neck and upper back or the lower back. So what are the common causes of back pain? Number 1 would be muscle or the ligament. These structures are usually affected by repeated heavy lifting or a sudden awkward movement. If you are in a poor physical condition, constant strain on your back can cause painful muscle spasms and aggravate the pain. It can also come from bulging or ruptured disc, or what we commonly know as slip disc. This is common cause among the young and the active individuals. Basically, the disc acts like a cushion between the bones of your spine, and this gel-like structure or substance can bulge or rupture and press on a nearby sensitive structure, thus causing the pain. However, it is very important to note that you can have a slip disc without any back pain. As long as the disc does not cause any pressure on the surrounding sensitive structures, then you're okay. Certain types of arthritis can also cause or present as back pain. Specifically, arthritis of the spine can lead to a narrowing of the space around the spinal cord and the neuroforaminal canals, or the canals where the nerve exits from the cord on its way down to the arms or legs. This narrowed canal can cause impingement of the nerve root, resulting in pain. And for the females who have undergone menopause or andropause for the males, osteoporosis can be a cause of back pain as well. Osteoporosis is a silent disease which results in brittle and fragile bones. Dahil brittle po sila, konting bangga lang po or konting tapilok lang, you can have a fracture. Next, let us discuss the risk factors or the things that makes us predisposed to back pain. And this is not listed in any particular order. But number one would be age. Back pain becomes more common as you grow older, starting at around 30 or 40, because this is the time when signs of wear and tear shows up. Lack of exercise is also a risk factor, specifically muscles of the back and the abdomen. Because your muscles are weak and unused, they are unable to fully support your spine. Excess body weight puts on extra stress on your back. It is said for every extra pound that you gain or you carry, 3 to 4 pounds pressure is placed on your spine. Improper lifting is a very common risk factor. Later on, we will discuss how to properly lift things. Some types of arthritis and cancer can also contribute to back pain. Psychological conditions, especially those people who are prone to depression and anxiety, have a greater risk for back pain. And surprisingly, smoking can be a risk factor as well. Animal models have showed that smoking can cause structural change in the disc because of altered blood supply. So now that we have the risk factors and the common causes, it is also important to know when to see your doctor. You see your doctor immediately, urgently, if you have new bowel or bladder problems such as incontinence. For example, you are chronically constipated and then sumakit po likod natin and then instead of constipation, you're now getting incontinence or napapadumi na po tayo or napapaihi na hindi natin namamalayan. If this happens, see your doctor immediately. When your pain is accompanied by fever, or when your pain was sustained from a trauma, like for example, a fall from a stairs, yung ganon, see your doctor immediately. It is also important to see your doctor if your pain would persist for more than a few weeks. If it is severe and does not improve despite medications and other home remedies, kung ano-ano na pong tinapal natin, nagplaster na, kung ano nang pinahid, nag-albularyo, nagbentosa, nag-chiropractor, hindi pa rin po gumagaling. See your doctor immediately. And if your pain is causing weakness, numbness, or tingling sensation, or if your pain is accompanied by weight loss, better to see your doctor as well. So once you've seen your doctor, he or she may request for any or all of the following tests. First off would be the EMG NCV, or what we know as the nerve test. EMG stands for electromyography, and NCV stands for nerve conduction velocity. Basically, this is a test for the nerves and muscles. And in the context of back pain, this is a test that can determine if nerve is the cause or the source of your pain. Also, it can more or less tell you where the damaged nerve is and how bad it is damaged. Plain X-rays or radiographs, CT scan, or MRI may also be requested to check for any structural changes. Bone densitometry or DEXA may be requested as well if your doctor wants to rule out or wants to check if you have osteoporosis. Here at Cardinal, our DEXA is combined with VFA or the vertebral fracture analysis. This measures the height of each spinal bones to check for their structure and if they're collapsing. And in some instances, your doctor may request for some laboratory tests to rule out other cause or disease entity. Now that your doctor knows the cause of your pain, he or she may prescribe the following medications, commonly anti-inflammatories, be it steroidal or non-steroidal. This is given to alleviate pain by reducing the inflammation surrounding the damaged nerve or ligament. Muscle relaxants may also be prescribed to lessen the muscle spasm. And for over-the-counter topicals, it is nice to know that there are studies that show strong evidence that topical capsicum can relieve back pain in acute stages or in the first 3 months after the onset of pain. Capsicum is a component of chili. Your doctor may also prescribe physical therapy. The aim of physical therapy is to improve function and prevent disability from getting worse. Physical agents may be used for additional pain relief, and exercises may be prescribed to improve the muscle flexibility, strength, and endurance. Low back pain guidelines regularly recommend the use of exercises for back pain. Your doctor will determine which exercise would suit you best. Our department boasts of having up-to-date physical agents and exercise machines to help you. We also take pride that we are the only hospital in the Philippines featuring the Chattanooga Cooper 360. This is a neuromuscular training machine that is excellent for improving flexibility, dynamic strength, posture, and balance. And last but most importantly, your doctor will discuss with you what are the things that you can and cannot do and the steps to prevent the exacerbation or recurrence of back pain. This is a very important because studies have shown that history of back pain is a predictor of its recurrence. In the olden days, doctors used to advocate bed rest if you have back pain. Nowadays, we no longer do that. We encourage you to engage in activities that you can tolerate. And because we encourage you to move about despite the pain, it is important to know how to perform these activities safely. When we are working or attending webinars or just lounging and doing a K drama or a Netflix marathon, it is important that we sit properly. When sitting, we avoid slouching. It is best that our monitors and tablets or phones be placed at eye level to avoid bending or protruding the neck too much. Better if our tablets or phones are placed on a stand to avoid wrist or hand pains later on. It is also best that we take breaks and stand up every hour or so. And when we are doing our chores, such as vacuuming or sweeping or raking your garden, it is important that we try to keep a straight back. And if we have to lift something heavy, especially off the floor, we bend the knees rather than stoop down. We brace our backs using our abdominal muscles, and we use our legs to pick up the object and stand. Remember to keep the object close to the body as we carry it. If it is too heavy to lift, magpatulong na po tayo. Remember, good posture can reduce the stress on the back muscles. So what are the other common things that we can do to prevent back pain aside from observing proper back mechanics? Importantly, we have to exercise. So what kind of exercise? No impact exercises such as brisk walking, swimming, stationary bicycles, stepper, or ellipticals are the best and the safest. You can also engage in yoga, Pilates, or Tai Chi as these are generally gentle exercises. Studies have shown that no one exercise is superior to the other. Your doctor will discuss with you and will determine for you which type of exercise would suit you best. As we continue to combat back pains, remember to sit smart, stand smart, and live smart. I hope I have shared something with you today that can help make your daily lives better. Thank you.
Thank you so much, Dr. Joanna. We will hear more from Dr. Joanna during the open forum at the latter part of today's session. We all know we have a lot of follow-up questions to her, so please stay tuned. Our next speaker spearheads the Diagnostic and Interventional Musculoskeletal Unit and our very own Bone Densitometry Unit. She was also the immediate past president of the Philippine Society of Ultrasound and Clinical Medicine and the former founding president of the Philippine Society of Clinical Musculoskeletal Ultrasonology. Ladies and gentlemen, I'm honored to present to you Dr. Bigyok Tansales to talk about knee pain, myths, facts, and treatment.
Good morning to you all. Thank you for joining us today. Pain, go away. Knee pain and osteoarthritis will be my topic with you today. Myth to dispel, facts to be reinforced, and treatment options discussed. The population is increasing. The senior group is growing. We are now 111 million in population. 8.5% of which are seniors, and a whopping 4.2 million have osteoarthritis. Osteoarthritis affects different parts of the body. The most common and debilitating is knee involvement. The knee cartilage or cushion starts to wear out until bony surface is exposed, causing the bone to rub against bone, hence causing pain. It also affects other joints like hip, back, ankle, and shoulder. To help dispel the myth, reinforce the facts, let me point out a few aspects like osteoarthritis is actually not found in the elderly only. Repeated injury in the young may lead to osteoarthritis. The same is true when we have frequent injury, we may get osteoarthritis later in life. There is genetic and hereditary factor, but if mom has it, it does not follow that you will get it too. Osteoarthritis is not serious by itself, but more debilitating, causing disability. But you can help prevent by keeping your weight low and listen to your body. Attend to any injuries, minor or major. We would like to dispel the notion about PASMA as well. PASMA is nowhere to be found in the medical literature. It's a hand-me-down notion from our Lola. It may not be related to exposing tired hands to cold water. Pag nababasa daw ang kamay after magtrabaho, madaling magkapasma at magka-arthritis. Rather, it's the repetitive activity that will predispose an individual to develop arthritis. Some individual wearing copper band or bracelet swears to high heaven it works. Based on study, it's actually a placebo effect. Next. The degree of arthritis varies. It might be mild, moderate, or severe. And if it's mild, it can be compatible with daily function, but it may progress to severe, warranting surgical management. Next, please. Causes of knee pain: osteoarthritis, gout, infection, rheumatoid arthritis, or repetitive stress injury can be causes for knee pain. Next slide. Knee pain is not only due to osteoarthritis, it can be due to gout, and we know that gout, once it attacks, causes severe pain. Patient with rheumatoid arthritis, there will be good days and bad days. Sometimes infection can also cause pain. Injury, of course, causes knee pain. Now, next slide, please. Patellofemoral pain syndrome. This is when the kneecap rubs against the big bone or the femur. So when the rubbing is more frequent, it can cause some irritation to your kneecap, causing knee pain, especially when you are squatting or going up or down the stairs. Sprain or strain. So we have to be more cautious about twisting unnecessarily or some vigorous impact to the knee. Obesity itself is a predisposing factor. So we now go to factors predisposing development of osteoarthritis. Age is one thing that we cannot avoid, and reports have shown that after the age of 45, chances of getting arthritis rises. Genetic and hereditary factor plays a role, so that when you have genetic factors, it is more important for us to watch out for factors or activities that may easily trigger this arthritis. Obesity, as previously mentioned, it impacts the back. It also impacts the knee joint. For every pound increase, there is 2 to 3 times impact to the knee while walking, and it becomes 3 to 5 times impact when jogging. Gender and menopause itself are something that cannot be prevented. So for ladies, studies have shown that female gender has a higher incidence of osteoarthritis. Repetitive stress injury at work or in sports can also lead to arthritis, especially during all these activities, you're sustaining mild injury or irritation to the affected parts. Overexercise or underexercise may also trigger arthritis of the knee. Why? Because overexercise, of course, have a greater wear and tear, whereas underexercise leads to muscle weakness, which may deprive the knee of shock absorbing mechanism. This tells us that muscle is not just for moving or movement, but it also shock absorbs for us. Some of the symptoms that we see, and for you to know you're getting arthritis, is morning stiffness. After prolonged sitting, when you get out of your sit, patient will complain, or you may complain of knee joint pain. Pain increases with activity, relieved by rest. And when you feel for the knee, it becomes warmer. There is also beginning deformity as if you look at the picture, the knee is starting to become valgus or varus, sakang or piki in Tagalog. Difficulty in bending, squatting, or climbing stairs are also signs that there's something wrong or starting to happen in the knee. More so when you start hearing creaking or cracking sound when getting in and out of chairs. Management of pain. When do we see the doctor? When the pain persists beyond 1 week, when there is intense pain, when there is history of injury, sudden swelling, redness, or tenderness to the knee joint, and of course, when there's really disability to weight bear. Management of the knee also involves surgery. But when the symptom, next slide please, but when the symptom is mild or moderate, surgery is still not warranted. Moderately advanced or severe pain are the usual factor that may warrant surgery. So what if you are not a candidate nor not ready for surgery? Next slide, please. This is where rehabilitation comes in. What will rehabilitation do? Rehabilitation decreases pain. These are the goals: improve patients' ability to perform daily tasks, help them adapt to imposed changes in lifestyle, prevent loss of function, prevent deformities and contractures. So therefore, we go to management of knee pain. If you look at the pyramid, and this is what WHO has recommended, look at the last or the baseline of this management: exercise, physical therapy, weight loss, or use of orthotics or braces are recommended. But as you go up the pyramid, physical therapy, exercise, weight loss are still the mainstay, whether you are mild, moderate, or severe in nature. When pain strikes, however, oral medication may be needed. In severe cases, steroid injection may be warranted. Aspiration of fluid that has accumulated inside the joint may also be done. In the advent of this viscosupplementation or platelet-rich plasma injection, these are options to alleviate pain and improve function. Viscosupplementation is a type of joint lubricant that can be injected to the knee joint, whereas PRP is using patient's own blood, where platelet is withdrawn through segregation and is injected back to the knee of the patient. This will help in tissue regeneration. Next slide. While we are talking about rehabilitation, it is we'd like to emphasize that Cardinal Santos Rehabilitation Center has the state-of-the-art facility with quality care. We emphasize your safety, your concern. Your safety is our concern. And the different modalities is used to alleviate pain. But again, we emphasize on exercise. We have to make the weak muscle stronger because it will protect and also reduce the impact to the affected joint. Next slide. The alternative management that I previously mentioned is the use of viscous supplementation. Joint aspiration may be done first, steroid injection followed. When the knee is dry, then patient may be a good candidate for hyaluronic injection. Now, if the hyaluronic injection is not working that well, the next step is to go to the plasma, platelet-rich plasma for some form of growth factors initiation. Next slide, please. Practical tips that to live by. Wear rubber-soled shoes, sandals, or slippers because it cushions impact. It is also advisable to wear PJ to keep the knee warm because cold weather, cold room, or temperature somehow exacerbate your knee pain. Why? Because the lubricant inside tends to gel up. It's just like the bearings. When the lubricant gels up, the knee becomes stuck up. We may use toilet seat elevator, as you can see in that picture, organize tasks within the house, reduce back and forth activities unnecessarily. If you have to go to grocery, pace your grocery trips so you can reserve your energy. And finally, keep the joint and muscle flexible and strong. Exercise every day. Next slide. Finally, four keys to defeat osteoarthritis pain. We have to stay lean, stay strong, stay active, and stay informed. Next slide. Modern medicine may not have found and improve quality of life. Thank you for listening and have a good day.
Thank you very much, Dr. Rabi. Now it is an honor to introduce the former leader of the Philippine Academy of Rehabilitation Medicine and the Philippine Board of Rehabilitation Medicine. To enlighten us on a holistic rehabilitation approach to stroke, we have Dr. Romil Martinez.
Good morning. Okay. Sorry for the technical difficulties. I hope everyone is feeling well and warm and comfy in their seats this morning to our dear viewers of this Webicon. For this morning, I am tasked to talk about a different topic, a little bit away from pain go away, which is, stroke rehabilitation, a holistic approach, which is part and parcel of the big patient load of the rehabilitation center. Okay. So the first question that we need to answer is that when does stroke recovery start? So when we want to partake or want to be able to be there as rehab specialists in order to maximize the recovery of the patient when the patient have a stroke. So it may start in an inpatient setting, meaning once the patient is stable within 24 hours, he or she can be started already with bedside rehabilitation in order for them to be mobilized, sit down upright so that they would be more active and the immobilization will be much lesser during that time. Once the patient is also or can be started as an outpatient rehabilitation treatment, okay? And you have to realize that the first 6 months of stroke is wherein this is the maximal recovery phase that the patient have. Okay, so we need to concentrate on that first 6 months post stroke. But nevertheless, with newer studies, there's what we call neuroplasticity, wherein our body is very adaptive, and even our brain is very adaptive. And even though after 6 months, years pass, we will expect still recovery from the patient. Next slide. Okay, these are the following institutions that you can see, or these are the following doctors that may see stroke. Okay, and don't worry, there's so many doctors. It's very important for you to see what you have symptoms or signs of stroke. Okay, it can be a family physician, it can be an internist, and the neurologists are our specific specialty that deals with stroke. And then you have different societies like the Stroke Society of the Philippines, the Philippine Society of Neurorehabilitation. But when it comes to treatment in terms of rehabilitation, we have the Philippine Academy of Rehab Medicine, or the physiatrists, or the rehab med doctors. Next slide. Okay, so the facilities for stroke rehabilitation, it's very important that patients and relatives should go into a very valid rehabilitation facility in order for you to have the best care for your relatives who had stroke. And specifically for rehab specialists, you can see in the slides that we have already come up with our guidelines, which is very important guidelines in terms of treatment of stroke from inpatient up to community reintegration. So when you see all of those lines there, the words there, those are the things that we have to look into and treat for a stroke patient. Next slide. So unfortunately, even though after the stroke and even though after they had treatments, a lot of patients will still experience problems, okay? And the most common problems will be movement disorder. The movement disorder is primarily walking, primarily in terms of hands activity. It can be in terms of balance, and it can be in terms of language problem as well. Okay, so what we do, we have different allied medical specialists that goes hand in hand with us rehab medicine practitioners. Okay, so we form a team, and one of the very important team here is our physical therapy, managed by the physical therapists. In here, they are primarily concerned with movements, okay? Making your muscles strong, stretching the limbs which is affected, at the same time, making you walk, giving you balance. As you've seen in the slides, there's a lot of equipment that you can use for your walking, for your balance, and for your upper extremity exercises, okay, for you to be conditioned. Okay, in Cardinal Medical Center, Cardinal Santos Medical Center, we have what you call a state-of-the-art robotics. Okay, so primarily, we have an upper extremity robotics. This is a very important facility because during the pandemic right now, this makes the treatment of stroke patient more, the social distancing for this will be more possible because the patient is just instructed in the computer, and then the robot will be able to do or simulate the exercises for the patient, primarily for the upper extremities. Another allied medical health is your occupational therapy. Our occupational therapies primarily, these are concerning in terms of your activities of daily living. They would be teaching the patient to be independent, primarily in terms of grooming, clothing, eating. Okay, so those are the things affected when you have a stroke. Aside from that, occupational therapists can also teach the patient on doing writing activities as well as memory exercises to enhance cognitive function of the patient as well. Okay. Lastly, we have our speech therapist, which is will focus on your language, okay, and vocalization of the patient, because some of patients will have affectation of their language centers when they have a stroke. Aside from these, they would also help you if you have problems in swallowing. So they will have tongue exercises for the patient, strengthening the oral mucosa or oral muscles in order for the patient to be able to eat and swallow food, whether it is solid or liquid, effectively. So everyone should be made aware that post-stroke morbidity is perceived to be the highest burden to the stroke survivor itself, the patient. And it's not only the patient who's having problems, it's the family and the society. So here in Cardinal Santos Medical Center, Department of Rehabilitation Medicine, we are here to help alleviate the burden and suffering as possible as we can. Thank you very much and have a good day.
Thank you very much, Dr. Romil. For our next speaker, at present, he serves as the chairman of the Department of Rehabilitation Medicine and a notable member of the Medical Executive Committee in Cardinal Santos Medical Center. Let us all welcome Dr. Eric Sherwin Basuil.
Dr. Ron. Thank you, esteemed Doctors Joanna Macrohan, Bigok Tansales, and Daniel Martinez, for your respective lectures on rehabilitation of back pain, knee pain, and stroke. To all our viewers, good morning. It was the 1990s. I was a physical therapist intern, my fifth year in college, and I first got a taste of what it was to work.
Dr. Basuil, sorry. Dr. Basuil, your volume is a little bit low.
Can you hear me now?
Yes, better.
Is it better?
Yes, po.
It's better now? Okay.
Dr. Basuil, it's the volume is low again. Po.
Mic test. Is it better?
Yes, we can hear you, po.
Okay. Thank you again, Dr. Ron. Again, Dr. Bigyok Tansales, Dr. Joanna Macrohan, and Dr. Ramil Martinez. Thank you for your respective lectures on rehabilitation of knee pain, back pains, and stroke. To all our viewers, good morning. It was the 1990s. I was a physical therapist intern, my fifth year in college, when I first got a taste of what it was to work at the Rehabilitation Department of Cardinal Santos Medical Center. Back then, okay, can you hear me now? Sorry for that. Anyway, back then, it was headed by the two foremost physiatrists in the country, my mentors, the husband and wife team of Doctors Tyrone and Ophelia Reyes. Already a trailblazer in the field of the rehabilitation medicine, the Cardinal Santos Medical Center has been the center where politicians, famous athletes flock to get their therapy. In the year 2013, in the year 2003, I came back to Cardinal Santos Medical Center as a medical consultant. And in 2014, I became the department chairman of the Rehabilitation Medicine. In keeping with the times, I witnessed how CSMC rehabilitation has evolved greatly. The facilities continually upgraded through numerous renovations. New equipments and new treatment techniques are always introduced from a handful. We are now 11 physiatrists, 33 physical, occupational, and speech therapists, along with our indispensable office staff. Already a frontliner in electrodiagnostics, we have now expanded our services by opening our very own electrodiagnostic laboratory and musculoskeletal ultrasound diagnostic and interventional section. So why go to rehabilitation medicine? Pain, weakness, and immobility are the foremost reasons why a patient is referred for rehabilitation. Often, each of the three would lead to the other, and together would form a vicious cycle that prevents a patient from functioning optimally. Pain, weakness, and immobility are shackles that must be broken with a combination of diagnostics, therapeutic interventions, prescription of physical modalities, exercises, pharmaceuticals, orthotics, and prosthetics. That is rehabilitation medicine. In the words of Martin Luther King Jr., if you can fly, then run. If you can't run, then walk. If you can't walk, then crawl. But whatever you do, you have to keep moving forward. Such is the goal of rehabilitation medicine, to push and prod the patient into moving forward while forging alliances with the medical, neurological, surgical, and other medical specialties towards reaching their highest level of function. In rehabilitation medicine, we use a multifaceted approach in treating our patients, from medical consultation to diagnostic and therapeutic intervention. We are able to bridge pharmaceutical and different rehabilitative disciplines to treat multiple sources of pain and other impairment. And these rehabilitative principles include therapeutic exercises using both conventional and state-of-the-art machines to relieve pain, improve muscle strength, and treat debilitating condition. And these are properly administered by certified physical, occupational, and speech therapists. Orthotics prescription to protect, stabilize, and aid in certain functions of a body part, and prosthetic prescription to replace a limb and approximate its function. Non-surgical interventions using EMG NCV and musculoskeletal ultrasound, leading to a more accurate diagnosis and treatment of patients' problem. And this includes EMG NCV and ultrasound-guided botulinum toxin injection, ultrasound-guided articular and muscular injection, and ultrasound-guided prolotherapy, or also known as your platelet-rich plasma injections. We persevere despite the trends of ongoing pandemic to provide our services to inpatients and outpatients alike. We take every precautions to make sure that CSMC Rehab remains a safe place for us to work and for our patients to heal. Not to rest on our laurels, we continue to take steps to better our services. Through the initiative of the hospital administration, our facility is undergoing another glow up and is set to reopen very, very soon. We are also excited about the acquisition of new machines to augment our robotics section, the only one of its kind in the Philippines. So, we go back again to the question, why go to BRAB? I can summarize the answer using the following acronym. R, restore whatever function you lose. E, enhance the gains you develop. H, we help you heal in the proper and most effective way. A, adapt in a condition that has been caused by a disease process. And B, build the person holistically in order to be a productive member of the community. In closing, I would like to invite everyone dealing with physical pain, weakness, and immobility to come here at CSMC Rehabilitation Department, whether following a surgery, caused by injury, pain syndromes, or nerve damage. Please ask your doctors, no matter what specialization, to refer you to us so you can see how our treatment offerings can help you alleviate your condition. Come to us and we will prove to you. Medicines may add years to life, but rehabilitation medicine add life to those years. Thank you very much for listening and have a nice day.
Thank you very much, Dr. Eric, for enlightening us about interventions and innovations we have in rehabilitation medicine. Your talk was very much understandable and relatable even to people who are not in the medical field. Now we have invited a patient who underwent neck surgery. He's a student from De La Salle University, and he will be sharing this afternoon, or this morning rather, his experience as a patient of Dr. Eric. Let us all welcome Mr. Nico Montano.
Good morning to all the doctors. Good morning to all the viewers. Good morning, everyone. My name is Juan Rafael C. Montano. I'm 21 years old and I'm currently a second-year college student. And today I'm going to talk about my testimony. So as a normal teenager, I used to play a lot of sports. However, I stopped as I would feel a sharp pain in my neck and in my back after doing physical activities. So in order for me to stop feeling the pain, I stopped playing sports. However, it still kept coming back. So I went to see a doctor, but based on the X-ray results, they did not see anything. So they thought that maybe it was due to my bad posture. So they gave me medications to alleviate the pain and certain exercises to help me with my posture. It did help at first, but the pain still kept coming back to a point that I was already used to it, and I would just brush it off every time it comes back. But not until earlier this year that I couldn't take it anymore. The pain kept on getting worse, and I started to notice that my right hand was starting to lose its grip, and my right arm is starting to feel numb, that I couldn't feel any pain or any temperature sensations. So I immediately told my parents, and we went to Cardinal, and the MRI was requested, and then uh, there we saw that I had a tumor in my spine. I was very devastated when I found out. I was completely lost, and I couldn't comprehend what was going on, as I thought that it was just a simple neck and back pain. And who would have thought that maybe that it was already a tumor? I had a lot of questions in my mind. I thought that what would happen to me? What would happen to me if I don't take surgery? What would happen to me if I do? And I was very fortunate enough to have met very great and wonderful doctors, as they were able to explain to me things clearly, and they were also able to answer all my questions. And they told me that if if I would undergo surgery, the condition of my right hand would probably get worse. But I still chose to undergo surgery as I couldn't live with the back pain anymore. So when I woke up in the ICU, just as what the doctors told me, I couldn't open my right hand. And then there I met Dr. Baswil. He was checking up on my conditions and he immediately requested for me to undergo rehabilitation in order for me to open my hands and get my grip strength back. So when I was discharged of the hospital, I still kept coming back to Cardinal Santos 3 times a week to undergo my rehab sessions. And there I saw that Dr. Baswil and the physical therapists were very accommodating, caring, and very attentive to my concerns. Dr. Baswil would also regularly check up on me every session to see my progress. And he and the physical therapist would always encourage me to give my best and give my 100%. So with their help, I was able to give it all, and now I'm able to open my hands. So these rehab sessions has taught me a lot about life and what I could do with myself. And my advice to all the patients and possible patients is to never give up and always try your best, even though it would be very frustrating. But with continuous rehab, hopefully you will be able to regain what was lost. Thank you for listening.
Thank you, Nico. With the roster of our speakers and the wealth of insights and learning shared, we now open the floor for your questions. We already have a few questions here. Starting with this question is directed to Dr. Joanna Macrohon. The question reads, there are many videos and ads on social media about chiropractic treatments and self-therapy for movement-related pain. How accurate are these and are they reliable solutions? Doctora?
Good question. As with everything else on the internet, it is very appropriate that we check the source of our source. No? Chiropractic treatments have their own science regarding behind their practice. It is not for me to say whether they are right or they are wrong. As with everything else, if you go to a reputable or a certified chiropractor, I think it would be your best option if you choose that road. Um, However, it is also best that you see a doctor before going to a chiropractor. As regards to the videos on the internet, check your sources, as there are a lot of sources which are not really reliable. So better to check your source and make sure they're from reputable hospitals or practices. I hope this answers your question.
Thank you very much, Dr. Joanna. We have another question here in our Q&A. This question is from Lai Reyes. I think this is also directed to you, Doctora. So the question reads, why does one have to be alarmed when back pain is accompanied by constipation, incontinence, or weight loss?
There are several implications for incontinence. Usually, the most common source would be that it involves your spinal cord. So once your spinal cord is involved, that's the more or less the center of all the nerves of the arms and the legs. So if they're affected, parang yung central generator yung affected nun. So you have to seek consult immediately to check out what's wrong with it. So I'm sorry, what's the other question? Incontinence and
Incontinence, constipation, and weight loss.
Okay. Incontinence and weight loss would more or less have the same source. They are coming from the spinal cord most of the time. So as I've said, they're the central generators of your nerves. So you would want to check what's wrong with them. As with the weight loss, some forms of cancer could present as weight loss. So you, as like our patient earlier, although he did not have any weight loss, but sometimes the cancer can come in as pain, as limitation of movement, as not necessarily immobility, and it can be accompanied by weight loss.
Thank you, Dr. Joanna. There's another question directed to you, Dr. from TET Defensor. Dr. Joanna, can you please explain further how smoking can cause back pain?
Okay. Smoking per se can cause structural damage to the disc. Once your discs are damaged, they can easily bulge out or easily protrude out and hit the surrounding sensitive structures. Once it does that, then it produces the pain. That's why it's important to keep the disc healthy. And since smoking can damage the disc, so we would want to stop smoking. Besides, if you stop smoking, your heart, your lungs, and the environment will also thank you.
Thank you. Thank you, Dr. Joanna. Our next question is from an anonymous attendee. This is directed to Dr. Romil Martinez. Dr. Romil, what do Filipinos need to do long term so they can avoid movement-related pain instead of ignoring it?
Hello? Yeah. Okay. In order for you to prevent having movement problems or prolonged immobilization, it's very important for you to be, common sense is you're moving. So when you go to a consult with the rehabilitation specialist, that's such a primary thing that we have to do is to instruct the patient in terms of home exercises program that you'll be able to do, that you're able to do at home in order to keep the joints in full range of motion, okay? So it's really just movement, stretching, and a little bit of exercises. Thank you.
Thank you, Dr. Martinez. We have another question for you. This is from an anonymous attendee. For stroke patients who cannot afford rehab services, what can CSMC offer to motivate them to seek treatment?
Okay. Number one, you have to really manage in terms of the treatment of rehabilitation for a stroke patient. You have to really plan for it because it's not going to be one session only. It will take several sessions for you to see an improvement. Okay. What the rehabilitation specialist can do is to space out the treatment in order for you to have lesser payments in terms of per session of the physical therapy or occupational therapy or speech therapy. And then we will give you instructions that you will have to do at home in order for you to continue that type of exercises. That's number one in terms of the frequency of the physical therapy. Number two, Cardinal Santos Medical Center, I believe, have a social service system wherein you can be referred to and categorized, and you will be given a lot of benefits in terms of free services. It can be in other services in laboratories, but as well as rehabilitation treatments as well. You can also go to other means of subsidizing your physical therapy. You can have government facilities wherein they give help to indigent patients to undergo rehabilitation medicine. Aside from that, we have a lot of discounts like your senior citizen discounts and your disability PWD, persons with disability discounts. So that adds a lot of saving to our patients. So all in all, I think a patient, whether they have money or not, can undergo rehabilitation treatments for stroke. Thank you.
Thank you very much, Dr. Romil. Our next question is directed to Dr. Digyok Tansales. Dr. Rabi. The question is from Tet Defensor. What can you advise individuals who are required to be in high heels every day?
First, this exercise that stiletto, which is quite involved for a while, is the real killer because the smaller the heel, the impact is greater. Good morning. Yes, required to use high heels. Let me just emphasize that the smaller the heels, the stiletto type, it's the killer that may lead to knee pain. What is more ideal and has been studied is that when you use 1.5 inch pump shoes, it will be more comfortable, easier to walk with, and will be less of a force pushing your center of gravity forward. When center of gravity is forward or pushed forward, the knee, the muscle has to work double to keep your center of gravity aligned. So if you can have a choice, the 1.5 inch pump shoes will be most ideal and will be most comfortable. The other thing that you might want to look into is the toe box. The toe box that is pointed is very excruciating and punishing to the pain. Kaya lang, tiis ganda. Now, if it is going to be a short while, no problem. But if you're going to wear it 8 to 5, please take note that if you do not have a comfortable shoes, then working will not on your feet will not be comfortable as well. So to avoid triggering arthritis and causing anterior knee pain, the other thing that you can also do is exercise. Keep your knee muscle and ligaments flexible by doing your quadriceps stretching and strengthening every day. 5 to 10 minutes will probably be at least enough. Then you also have to stretch your hamstring. I hope I answered your question.
Thank you very much, Dr. Rabi. We actually have another question for you from an anonymous attendee. So the question reads, Dr. Bigyo mentioned that movement-related pain is considered as an elderly condition, but younger people can be afflicted by it too. How important is pain treatment in young people? Should movement-related pain be a cause of concern for the younger generation?
Yes. For younger individual, especially the ones who are highly competitive in their activities and exercises, they have to listen to their body. Any minor injury, any minor pain, they have to attend to it. Either doing it on their own, but if pain persists, they have to seek for professional consult, because if that pain is allowed to linger, it may also affect other structures, most especially the muscles. A painful part will usually induce muscle reflex inhibition, meaning the painful part will send signals to the brain. Hey, huwag kang masyadong gumalaw, masakit. And just by doing so, the muscle will shrink or will atrophy. Aside from that, the muscle, when it atrophies or shrinks, it becomes weaker. At the early start, you may not notice it, but when you start noticing that you are favoring, bine-baby mo yung joint na yun or yung part na yun, sooner or later, you will notice na mas mahina siya because atrophy and weakness goes hand in hand. So what is more important is listen to your body. If the pain persists, then seek for professional help. On the other hand, when you're exercising and you feel like you have overexerted, then take a rest. You may have to stretch your muscles. At the same time, if you need icing, you can do icing and stretching. On the other hand, individuals who are doing daily activities, repetitive activities, you may have to rest your part in between. Just 5 or 10 minutes of doing your stretching and movement exercise, just like back pain right now, which is very common because of the COVID, and we sit a lot doing everything at home. Get out of your seat, stand up, okay? So That's what we need to do. Listen to your body, attend to it immediately, small or big. For the smaller one, it heals faster. And for younger individuals, the usual notion is kaya ng katawan nila. True, the body repairs sooner and easier. But if the small residual remains, that is the one that may lead to bigger and greater problems sooner. Thank you.
Thank you very much, Dr. B. You're very much in demand, Doctora. You have a few more questions here. I think this is for Dr. Bigyo. The question reads, this is from Mr. Dante Morales. What are the latest studies on platelet-rich plasma growth factors for arthritis? And I think along with this question, there's another question that you can already answer together with this. When do you give glucosamine or collagen supplement for knee pain? And can you give it at the same time?
Dr. Morales, am I right, Dr. Morales? The latest studies on platelet-rich plasma, it is more effective with the knee joint instead because it started being used for tendons, the shoulder. But the latest study showed that it has more effect for the knee joint because of the growth factors. There's no hard evidence and strong evidence yet, but the universities like Harvard, Yale, they are starting to dwell on it because the results are very promising. So we'll have to watch out. And so far with our own patient with platelet-rich plasma injection to the joint, it relieves them of the pain and allow them to have a better function. Now, as far as glucosamine, if we go for the American Academy of Orthopedic Surgeon, and the American College of Rheumatology, they have absolutely disregarded the use of glucosamine. In fact, years back, the only thing that they were able to prove for the use of glucosamine is a minimal pain relief. Whereas collagen, right now, there's a lot more studies coming up. In our own institution at UST, Faculty of Medicine, we did a study using collagen for patients with early arthritis. And with the use of ultrasound, we were able to show that there is some influence and positive effect in preserving and protecting the cartilage. The thinning out is slowed down, and there are individuals or patients who have shown increase in the thickness of the articular cartilage. So far, that's what we have on hand. And therefore, collagen taken properly, in fact, we kid with our patient, collagen taken properly and the right dose and medical dose, because there are a lot more of collagen in the market that may not be of medical grade. It also affects your cutis. So when we tell our patient about that, mas gagandang cutis mo because of the collagen, then we are able to convince patient. However, since again, there's no hard evidence and these are just supplement, we ask the patient to take it continuously for at least 6 months. And there are patient-to-patient's individual response to medication. So if the patient have a good response, and what they usually report is that it's easier to move their joints. There's less pain. So, but we have to be selective because collagen will work better when we are dealing with early arthritic patients. Thank you.
Thank you very much, Dr. Rabi. I think this question is directed to Dr. Eric Baswil. Dr. Eric, question is from Lucky Magno. COVID-19 has widely affected delivery of healthcare. In response, telerehabilitation has emerged as an alternative care model. How is your response to the ongoing COVID-19 crisis that continues to limit face-to-face access to physical medicine and rehabilitation services throughout the country? Do you also offer this telerehabilitation?
Actually, in Cardinal Santos Medical Center,
Doc Eric, sorry, we cannot hear you po.
Can you hear me now, Ron?
There, yes po, Doc. we
Okay.
can.
Again, good morning, Lucky. Thank you for that question. Here in Cardinal Santos Medical Center, all our physiatrists are available in the e-consult format. You could access them at CSMC e-consult. And then once you are evaluated by the physiatrist, since some of them cannot go face-to-face, we could suggest telerehabilitation. We have therapies to do that. But of course, we have some requirements before you could do that. Like the patient should be cognitively able to understand exercises. And then, or if they're severely impaired, they should have a caretaker to assist them on the telerehab. And of course, one of the disadvantage of telerehab is that the physical modalities and other assisted stretching or exercises cannot be done. But yes, in Cardinal Santos Rehabilitation, we offer telerehab and also e-consults for your consultations with your rehabilitation doctor. Thank you, Ron.
Thank you very much, Doc Eric. The next question is, I think this is directed to Dr. Joanna Macrohon. This question is from Angela May Abad. The question reads, how can we practically heal back or any muscle pain while we're in a work from home setting? Any exercises or best practices you can share?
Yes, with work from home setting, yes, there are certain exercises or things that you can do to help alleviate the pain. First off is to observe proper body mechanics and posture and to take breaks every so often. You have to stand up from time to time and stretch out. With regards to exercises, exercises that focus on strengthening and
Hello.
flexibility would be beneficial to you. And if your pain does not resolve, better to see a doctor. We can do a fascial release for your pain.
Thank you, Dr. Joanna. You have another question from Mr. James Ryan Gorospe. The question reads, for Dr. Joanna, do you recommend home remedies like hot or cold compress, painkillers if the back pain is intermittent?
If the back pain is intermittent, better, and it's of a long-standing one, and if it's getting severe, better to see a doctor. For home treatments, with regards to pain, hot or cold compress will help. They're both effective for pain relief. You can use whatever is more comfortable for you. And if it's intermittent, with regards to medications, I would advise against taking medications, even just for intermittent periods, because medications, as you know, have side effects. They can damage your liver or your kidneys, especially if taken in the long term, even if it's intermittent. So if it is persistent for a period of time, better to seek consult.
Thank you very much, Doctora. Our next question is directed to, I think this is for Dr. Eric Baswil. Doc Eric, the question reads, is it possible that emotional distress can affect or delay the progress of the rehabilitation process? How do rehab doctors deal with this? This is from Rory Visco of the Business Mirror. Doc Eric, sorry, we cannot hear you again.
Anyway, here, can you hear me?
Yes, Doctora, we can.
Okay.
Yes,
Good morning. Good morning, Rory. So, yes, emotional distress can affect the response of a person during rehabilitation. That's why our physiatrists would not only look at the physical pain, but also would ask you thoroughly so your history and examination on what other can cause you pain. So in that, aside from being a doctor giving you medicines, rehab doctor also encourages patient to do therapy and maybe tell some stories about successful patients so that they could aspire on becoming well as well. No? So emotional the emotional condition of the patient is also a big factor in patients undergoing rehab, especially on those conditions that are already chronic. No, of course we have to see as a doctor that this person, before having this impairment or dysfunction, maybe what's the premorbid condition. So, and one goal of our rehabilitation team is to at least let this patient go back to that premorbid state, and if the impairment cannot permit that, or the impairment is already permanent, again, as I told you earlier, we help you adapt. Okay, so that the activities of daily living, your activities will be much easier. So I hope I answered that. Thank you.
Thank you very much, Dr. Baswil. The next question is directed to, this is for Dr. Abigio Salis. This is from Monsi Serrano of the Philippine Business and News. The question reads, I had arthroscopic surgery of my left knee that eventually led to the replacement of my patella. The operation was done in 1995. I never experienced knee pain commonly experienced by those who had the same procedure. Is this a temporary condition? Do I expect pain when I age? My way to combat it is by always walking around. Thank you very much.
Good morning, Monsi. I would say you're lucky and you're blessed. It has been 26 years after your arthroscopic surgery and patella replacement. You have a good surgeon, you have a good surgery and a good outcome. You have been protecting it and doing the right exercises, and I would presume you are on the lean side. Now, as far as the pain, will you expect pain later in life? I cannot exactly say yes or no, but if you maintain what you're doing now, protecting the strength, flexibility, and exercising regularly, those are the different factors that will help reduce the conversion of this surgical condition and injury to arthritis. So let's hope that you will not have pain, but maintain your flexibility, maintain your exercise, then you should be okay because it's been 26 years.
Thank you very much, Dr. Rabi. Another question for you. This is from Millet Season. I recently had a case of frozen shoulder and loss of strength of my dominant left arm. Is it possible to regain it back?
However, yes, of course, Millet, it is possible. However, we have to look into the causes behind that frozen shoulder. Because if it is a primary frozen shoulder, which we do see among female, normally after a period of 2 years, there is such thing as spontaneous recovery. But of course, if you're a working professional, you cannot afford to have such a long frozen shoulder. So what is important is if you can consult a doctor and find out what is causing it. Did you have any injury before causing some form of tear that causes the persistence of this frozen shoulder? Then manage the cause and regain strength so that you also regain function. Thank you.
Thank you very much, Dr. Rabi. The next question is for Dr. Eric Baswil. Dr. Eric, so the question reads, for Dr. Baswil, it is very cultural in nature for Filipinos to just take pain and bear it in order to avoid going to the hospital to get a checkup. What are the disadvantages of having this attitude?
Yes, can you hear me, Ron? Okay. Actually, that is a very accurate observation. And unfortunately, it is very common in clinical practice to see patients in such aggravated stages. And there are many reasons for this. And it's not only cultural. Some of our patients are too busy with work. Some are scared to go out their houses because of the pandemic. It could also be economic reasons, or some patients just don't know where to go and where to get help. So patients think they will just get better without getting treatment. Some do, some don't, and they end up getting worse. So like I talked about earlier, pain can lead to immobility and weakness. And immobility leads to more problems. The earlier you get diagnosed and treated, the better chances you have of avoiding these complications and thus breaking the cycle of pain. Thank you, Ron.
Thank you, Doc Eric. The next question. This is for Dr. Rabi Gyoktan-Sales again. This is from an anonymous attendee. The question reads, I'm going to modify the question. Will calcium supplements help prevent arthritis or osteoporosis as advertised?
Sorry, can you repeat the question? Hindi ko makuha.
Sorry, Dr. Ra. The question reads,
Okay, here.
will calcium supplements help prevent arthritis or osteoporosis as advertised?
Calcium is an element that is needed in the bone, but we are talking about the internal substance of the bone. So yes, taking calcium supplement will help definitely with preventing osteoporosis. Arthritis itself is not directly related, but when you take the combination of calcium and vitamin D, specifically vitamin D, it has been reported that it is good in improving muscle strength as well. So if the muscles are strong, then again, it will redound on preventing weakness, injuries, therefore prevention of arthritis.
Thank you very much, Dr. Ra. Thank you very much, Dr. Rabi. The next question is for Dr. Joanna Macrohon. The question is from Leomi Sanchez. The question reads, are persons with high blood prone to pains such as back pain, hand pain, body pain, etc.? And how do we avoid it?
Penny, it might be the other way around. It might be that your back pain, your hand pain is causing the high blood pressure because pain is not comfortable. So it can bring your blood pressure up. You might want to consider that aspect. It's not the other way around.
Thank you very much, Dr. Joanna. The next question is directed to Dr. Romil Martinez. The question reads, for stroke patients who cannot afford, oh, we already read this question na pala, no? This is also for Dr. Romil pala, sorry. What do Filipinos need to do long-term so that they can avoid movement-related pain instead of ignoring it? I think we read this already. Sorry, I reread the question. Okay, so I'll just browse through the questions that are sent to us. Okay, to Dr. Baswil, Doc Eric, the question reads, does ergonomic devices such as ergonomic chairs, desks, keyboards, and mouse, computer mouse, out in the market true to really help body pains? Do you advise in using such? And if so, which would you recommend best?
Actually, those ergonomic devices really work as long as they are used properly. So,
Doc Eric, sorry, we cannot hear you again.
okay, can you hear me now? Is it clear?
Yes, doctor. Yes, ma'am.
Okay. Actually, Ron, those ergonomic devices that are you see in internet and everything they really do their work. No? It will help you to relieve the back pain and everything. But here in Cardinal Santos Medical Center, as a physiatrist, that's what we do. We help educate patients on what chair to buy, on what type of the setup during school. Like example, when you use your computer, it should be on the level. No, the chair, no, it should be straight and not slouch, because the height of the chair can cause that. So that's what we call ergonomics in rehabilitation. We teach you the proper technique on positioning, and we tell you what devices to use. Because as we all know, these are repetitive movements that we encounter, no? Especially this pandemic. Like we sit for a prolonged period of time on a meeting, on conferences. So we teach you how to use this ergonomic stuff to help you to decrease the pain. That's why it's very important for you to see a doctor, so that we could tell you what ergonomic stuff to use to help you decrease the back pain.
Thank you, Dr. Baswil. We have another question here from an anonymous attendee. I think this question is for Dr. Joanna Macrohon. The question reads, what are your thoughts about pain treatments that focus on the fascia, like fascial manipulation and fascial release techniques, that have a lot of evidence and research right now that are really promising in the field of pain management?
Fascial release or manipulation is effective. The important thing here is proper patient selection. There would be patients who are more suited to this, and there are also patients who would do better without it. So I think it's better if you can discuss this with your doctor if you're considering this type of treatment, and see if you are a good candidate for a fascial release or a fascial manipulation.
Thank you very much, Dr. Joanna. Okay, we actually have a lot of questions here. To Dr. Romil Martinez, we have a question here. The question reads, is there such thing as stroke in the spine?
Well, stroke in the spine, meaning the definition of a stroke, if there's a blood vessel occlusion, there could be. That's we have what you call the Adamkowitz, which is you can present with a spinal cord injury because of a blood restriction to the spine, which causes a different type of paralysis. Okay, so it can happen. Thank you.
Thank you. Thank you very much, Dr. Romil. Question for Dr. Eric Baswil from Edsel Lorete. Question for Doc Eric. If you have osteoarthritis and you have it in your family, will it be a lifetime health problem? How do people with such get around it and live life normally?
Yes, again, as we all know, osteoarthritis is a non-inflammatory type of arthritis, meaning it's like an overuse. And again, as Dr. B would say, it could also be in your family, no? So if you could have it. So if you have it, so the real point of taking care of it is, again, to strengthen all those muscles that support your joints, because these muscles will weigh the joint, no? And decrease weight, exercise, and take supplements, which could also help. I think that's it.
Thank you. Thank you, Doc Eric. Now, we have a question here for everyone to answer. The question reads, what do you want patients who are apprehensive about getting any movement-related pain checked to know? How can you encourage them to visit their doctor for it? So let's start with Dr. Joanna.
I'm sorry, I didn't get your question.
Okay, I'll read the question once more. What do you want patients who are apprehensive about getting any movement-related pain checked to know? And how can you encourage them to visit their doctor for it?
Okay. What do you need to know? You need to know how to respect your body. You need not to rest. Just to do you can do activities as tolerated. So you have to listen to your body. If your body is telling you that this is too much, then it probably is. But if you feel that you can tolerate the activity, then you might as well go ahead and do it, as long as you observe proper body mechanics and make sure that when you do your activities, you do it in a safe manner. To encourage you to go see a doctor, you listen to your body. If your pain is progressively getting worse, if you're getting other signs and symptoms aside from the pain, um, whatever you do, the pain doesn't go away, then you better see your doctor.
Thank you very much for that answer, Doctora. Doctora B, I will repeat the question. I'll repeat the question. What do you want patients who are apprehensive about getting any movement-related pain checked to know? And how can you encourage them to visit their doctor for it?
To avoid movement pain disorders or pain-related disorders, first and foremost, take care of your body. And when we say take care, there are different factors that we have already mentioned, and these are modifiable factors. The weight, we have to keep the body weight low, or at least around the ideal body weight. It might be difficult, but as long as you couple this with exercise, regular exercise is also one good thing to help avoid and prevent movement-related pain. But when we say exercise, it has to be a judicious exercise. You cannot overdo. If you overdo it, you may also lead to some form of strain or overuse, which may lead to your muscle pain the next day. That can also be a long-term effect if the degree of pain is really significant, affecting major structures. So judicious exercise, keep the body low, listen to your body, and stay strong, stay fit. Thank you.
Thank you very much, Dr. B. Dr. Martinez.
Yes. I always tell my patients, especially when they tell me that they're having this movement type of pain for quite some time already before they see me, I always tell them, if you have any problems in any part of your body and there's pain that lasted for more than 3 days, you have to see the doctor. Why? Because that is easier to treat than a pain which is months and years. So you have to really take note of that. The earlier that you see the doctor, it's easier and earlier for you to get well. Okay. Number 2 is don't be afraid. I always also tell my patients that I'm in rehabilitation medicine. This is not a passive doctor-patient relationship. We need your participation 50%, and we will give you 50% as well for the treatment. An hour and a half of physical therapy will not be sufficient if you're still not resting, or if you're still doing the repetitive problem for 8 hours a day, or for example, you're sleeping in a wrong position or in a wrong, your bed is not right, sleeping there for 8 hours a day, our physical therapy or our treatment for an hour and a half will not be sufficient. So your participation in the treatment process is very, very important. Okay, so that's it for me. Thank you.
Thank you very much, Dr. Romil. Doc Eric.
Okay, Ron, for that last question, I also have an acronym for that. So R, just like Dr. Joanna said, R, respect your body. So if you have pain, that means maybe you're doing something wrong. So R, respect your body. E, as Dr. B would said, exercise. So there are a lot of exercises that can be done even though you have pain. No, it's not, if you have pain, you cannot exercise. That's why we, the rehab practitioners, would tell you what exercises to do or can be done even though if you have pain. H, be happy. No, have you seen a person who is happy, who experiences pain? So if you're happy, I guess you wouldn't experience pain. A, act early. So if you experience pain, go to your doctor, so we could tell you what causes your pain, so we could identify the problem. So if we could identify the problem correctly, it's already half the solution. And we could give you some solutions on how to solve it. And from our practice point of view, we could give you some physical modalities, exercise, and all of the stuff. And lastly, B, believe. We have to believe in what we are doing. Half of it, now if we believe, it will eventually come true. So that's it, Ron.
Thank you very much, Dr. Eric. I know we still have a lot of questions unanswered, but I'm sorry, we are currently running out of time. Thank you very much for your questions. With that, we formally conclude this morning's Webicon. This would not have been possible without the collaboration of different departments in our hospital, our media partners, and most of all, our valued patients, partners, and guests. Thank you so much, everyone, for making our Webicon a success. To our speakers, Dr. Joanna, Dr. Ramil Martinez, Dr. Rabigio Cansales, and most especially to Dr. Eric Baswil. Thank you so much for spending your time in making this third Webicon series happen. We hope that we are able to enlighten and motivate everyone to never forgo medical treatment as we ensure everyone's safety in providing world-class medical care. At Cardinal Santos Medical Center, we will help you let the pain go away. Thank you very much. Let us know your Webicon experience by logging on to www.menti.com, inputting code 64241900 to evaluate this session and to let us know your suggestions and recommendations. You may also access the evaluation, which will be emailed to you shortly. Before we finally end, we will be promoting everyone to be panelists, so you may open your videos and turn on your cameras for our photo opportunity. May I please ask everyone to turn their cameras on and smile. Is everyone... All the participants can, who would like to be included in the picture, can turn their cameras on. Okay. So I'll just count. 1, 2, 3, smile. Thank you. Thank you very much. Thank you very much for attending our Webicon. Have a good day.
Thank you, everybody.